Big breaking news coming in. The nationwide COVID-19 vaccination to begin from January 16th. The decision now has been taken after Prime Minister Modi chaired a high-level meeting to review status of vaccine preparedness in the country. Priority going out to healthcare workers and other frontline workers. Also those above the age of 50 years and those with comorbidities to be given priority. Paulami Saha joining us for more details on that. Paulami, take us through this announcement that's coming in, a decision that's been taken right after the high-level meet. Vaccination drive finally to begin from 16th of January. Take us through the details of it. Is it going to happen pan-India?
Yes, the decision has been taken at a high-level meeting which was chaired by Prime Minister Narendra Modi, the Cabinet Secretary, the Principal Secretary to the Prime Minister, Health Secretary and other senior officials in the Government of India who are of course, watching over the process as it is to unfold, were present in that meeting. Prime Minister took stock of the situation in terms of, the logistics of it, whether it's a seamless chain that we formed, of course, took stock of the dry runs which have been happening, one which happened across 615 districts yesterday as well. And at the end of the meeting, it was decided that the vaccination drive countrywide would start on the 16th of January, given that there are a couple of festivals like Lori and Mali, which are just before that. So it was decided that 16th of January is when this vaccination drive will begin across the country.
Well, thank you very much, Paulami. Do stay with us. We have a guest joining us, Dr. Rajesh Parekh, who's a medical director, joining us for more details on that at Jaslok Hospital Research Center. Dr. Parekh, here's an announcement coming in from the Modi government that January 16th, the inoculation drive will begin pan-India. Take us through the challenges that one might face, but this does come as a huge relief for the population on the whole. We've been battling the COVID-19 pandemic. Lakhs of people have passed away already owing to this scare. And now the vaccination begins. What's for us to be aware of?
Yes, thank you for inviting me on your program. Always a pleasure to be with you. There is tremendous relief in the announcement and a mild degree of concern as well. The relief, of course, is that finally vaccines are available across the nation. And, that's a tremendous thing. The concern, of course, is this is a monumental campaign. Nothing like it has ever been seen in the history of mankind in terms of the speed with which it will be implemented. On the other hand, we should be confident because we have successfully conducted two major vaccination campaigns, the smallpox eradication program of the 60s and the polio eradication program more recently. And the penetration of those programs were in the remotest parts of our country. And that has now become a model for the world to see. So we can be confident in that. Of course, there are going to be concerns, largely logistic at this point of view. The vaccines need to be maintained at a cold chain, which basically means that they have to be maintained refrigerated from the point of manufacture until a little before administration. And, true dry runs have been carried out. So I'm sure that will go through smoothly, though one could expect a few glitches here and there. And then, at the time of administration, although it will be done very fast, the vaccinators need to be mindful of the individual histories of the people they're vaccinating, more specifically so in terms of allergies, because allergies are known with these vaccines, and sometimes they can be life-threatening when they go to the extent of anaphylaxis, which is, of course, rare. So they need to be prepared to deal with that in terms of steroids and other medications that is available. I believe that has been factored in because post-vaccination, people will have to stay in for about 30 minutes to make sure everything goes through smoothly.
Right.
So these are very exciting times. And
it is indeed. We're mighty relieved that this announcement has come in. And there was a nationwide vaccination dry run that took place, was largely successful. But when we speak of the first phase of inoculation, especially priority given to the high-risk groups, the frontline workers, healthcare workers itself comprise of 3 crore individuals, citizens of India. That's going to be a mammoth exercise for the government. When you speak of knowing your individual history, if you do have comorbidities, what are those comorbidities that one needs to be aware of typically? And how do you actually convey that message to those authorities?
Okay, so let's keep aside the comorbidities that actually entitle one to be in the first group, because those are done with. But perhaps we could talk a bit about the comorbidities that pose a risk during vaccination. One of them is cancer. Patients who are on chemotherapy, they would already have a compromised immune system. And the vaccinators need to be aware of that. Anybody who's on any kind of immune suppression, anything that has weakened the immune system, sometimes people who've received organ transplants are on drugs which suppress the body's immunity. So that needs to be told. Of course, somebody who's suffering from COVID 19 currently should not get vaccinated. Somebody who has recovered very recently should wait for their turns. And more important, if anybody has had an history of allergy to any medication, it's unlikely people would have had histories of allergies to vaccinations because these drives were done long ago and always in children. But if there's any kind of an allergy, they should alert the vaccinator so that that person is ready with whatever might be required if there's an emergency.
Right. Dr. Parekh, this question that's been asked time and again over the recent past, considering 90 people who've come down from the United Kingdom to India have tested positive of the new UK strain, the mutated strain that's found in the United Kingdom. Now, though 90 people have tested positive in India, the question is, will the vaccines be effective enough to fight against the new virus strain as well?
We don't know for sure, but there's every reason to hope they will be. For instance, just yesterday, a study was released, conducted by Pfizer and the University of Texas, in which they looked at blood samples of people who had the new variant as established by genomic studies, and then looked at what happened to people who got the Pfizer vaccine. And the data is very robust and compelling that the Pfizer vaccine at least has worked on people who've had the mutant variant from England. On the other hand, I must caution that this has not been peer reviewed. This is publication data. But just going by that, there is good rationale to assume that the vaccines will be effective. But for that, we need a separate study altogether.
Absolutely. I'm not sure if you can give us insight into this, but Dr. Parekh, all questions asked about how to register yourself. Would you as a doctor know if your hospital is one accredited center for where the vaccination will be given out? And if not, what are the centers one must look forward to? And the CoWIN app, any insight that you would have, how to register your details and make yourself eligible, a beneficiary to this vaccine?
Absolutely. So to begin with your first question, our hospital, the Jaslok Hospital and Research Center in Mumbai, will be giving vaccinations. Our CEO, Mr. Haryan, in fact, just day before yesterday, sent out a memo asking us to register because, all of us in the hospital are in the first category of priorities. I'm not sure if the CoWIN app has yet released. I know it should be released anytime now.
About information of themselves.
Yes. So on the CoWIN app, what will happen is first will be the identity. So the identity needs to be established. It would be safest to do it with a form of identity if we have the options, which is least likely to pose problems if there's a security breach. For example, I would give my driver's license rather than any other card. But depending on what the requirements are, they are not clear as yet. It appears it might be the Aadhaar card. One is to establish one's identity. And then, of course, there'll be questions. The demographics, for example. So if one is above a certain age, 50 in this case, one becomes eligible to be in the category.
Right.
If there
we know the eligible category, but what we're still unaware of completely is that how does those eligible actually give out their information? And are hospitals collecting information and documents? Are you providing any detailed database to the government so that those people around your vicinity or area come in?
Well, I don't fall into a typical example because my data is already within the hospital and would be provided to the government. I think your question is more pertinent for people who need to provide that information. And that's where the CoWIN app will be very useful because one needs to log into the app, identify oneself, and then there will be a series of questions which one will need to answer. I don't think those questions are going to be too many or too complex. But once those are answered, then it becomes possible to set up the hierarchy.
So just a quick question, doctor. One can't just stray into the hospital, walk in and give out their documents physically and get vaccinated. That's not happening.
I don't suppose so at this moment. but we have to be very, very flexible to get the maximum number of people vaccinated. I won't be surprised at some point if there is a change in policy and people can just walk in and get themselves vaccinated.
Okay, last question
But
as
that's
I
not
wrap you
happening
here.
on the 16th.
Here is the vaccination that's just going to be the inoculation drive that will be started off. A quick question on whether this is compulsory for every individual to get vaccinated, or is it voluntary? And what would you say to those naysayers?
Right now it is voluntary. There's a very interesting history. I don't want to get into the details. It's just by coincidence that we've written a book on the vaccine. It's called The Vaccine Book, and it just got uploaded on Amazon Kindle a few hours ago. And in that book, we've given the history of how vaccination was made mandatory 200 years ago. Believe it or not, even then there were anti-vaxxers and conspiracy theorists. And the government in the US was forced by the Supreme Court to withdraw compulsory vaccination. So there's been a past history of that. I don't think it will be compulsory.
So would you recommend one to get vaccinated or not?
Oh, absolutely. Because, when we get vaccinated, it's not just for ourselves, but it's for the people around us, for family members, for elders in our family. Because in getting vaccinated, we are contributing not only to preventing the disease within us, but arresting it in its tracks in the community.
Right.
Because when a critical mass of people get vaccinated, and this has happened in earlier programs also, polio, for example, most recently, 60 to 70% of people get vaccinated. The coronavirus is stopped right there in its tracks. So we have a social responsibility to get
Absolutely.
vaccinated.
Let's hope that happens just that way. Thank you very much, Dr. Parekh, for giving us those details.
Thank you.
And the government has very clearly notified time and again that these vaccines are safe. Covishield, Covaxin, that's got approval for now. 16th of January, the big day where the entire country will go into the first round of vaccination. This is a decision by the Modi government right after a high-level meet. A much-awaited news there.